Hello everyone, how are you? Welcome to Dr. Kim's Dental Radiology channel. So this morning, I was asked by one of our faculty to evaluate two specific areas on this panoramic radiograph. So I want you to take a look at these areas and see if you can come up with the right answers. So the first one was this opacity in the maxillary sinus. So let's take a look at the right maxillary sinus, and she pointed out this area right above the roots of I'm presuming tooth number 2 and 3, or possibly 1 and 2, depending on whether we lost number 3 previously. So anyway, superior to maxillary right molars, we see this opacity that demonstrates a very smooth outline. We often use the term dome-shaped radial opacity, and it appears to be sitting right on the floor of the right maxillary sinus. So I'm tracing the wall of the maxillary sinus, and this is sitting right on the floor of the maxillary sinus. Let me see if I can adjust the contrast to bring out the anterior border of this entity. So there it is. Despite the fact that we see large carious lesion on this molar, she did say that the patient is asymptomatic on the teeth, also with no signs of sinusitis or sinus-related symptoms. I think I've shared a couple videos in the past including these findings. This is a very, very classic representation of, hopefully all of you can say the answer, and this is mucus retention pseudocyst. Again, this is mucus retention pseudocyst. So if you knew the answer, that's great. Okay, you did a great job because faculty wanted to confirm this with me. So if you knew the answer, you're doing a perfect job. So now let's take a look at the second area. This might be a little bit more tricky, but the second area of a concern was this radiolucent line, thin radiolucent line, which appears to be right at the base of this coronoid process. If you look over to the other side, for your reference, that might help you to determine what that is. So I'm going to zoom in a little bit to better visualize the area and see if you can come up with a proper answer to this appearance. Okay, so I'm going to zoom in. Let's see if I can go in even further. Is that too much? Anyway, this line here. Okay, so what is that line? If you see this, what would you consider? Well, if you have considered, oh, sorry, I think I zoomed out just a little bit. If you've considered the history of trauma, I'm okay with that. I think that's absolutely fine to consider that. It's okay to ask the patient if he has had the history of trauma in this area. But if this wasn't a trauma, what else would you consider? And this can be a little bit tricky at the predoctoral level, and this could be better answered if I adjust the contrast a little bit. Okay, so I think this is a kind of good contrast level to make my point. So without giving you the answer yet, I want you to still come up with potentially another differential diagnosis before you make up your mind. So now let me go over to the other side, because it's always nice to be able to compare, right, to the other side. And that's what we see. Although it's not quite radiolucent, we see like a opaque border and maybe a thin radiolucency just next to that, inferior to the opaque border, but this line pretty much coincides with what we saw on the contralateral side, except the other side looks a little more radiolucent. But what's interesting to note is this line doesn't just end there, let's see if I can adjust the contrast once again. It actually is continuous and it goes up in this direction. So now you have to answer what this radiopaque entity is. Again, are you going to be considering fracture involving the left coronoid process, or could this be something else? I could have made this into a quiz question, but given the complexity and difficulty of this question, since I really haven't gone over this before, I'm just going to tell you what this is. Again, we come back to the patient's right side, and then you can see that radiolucent line actually just doesn't end here, but it actually continues superiorly in such direction. Right? So let's see if I can adjust it a little bit better. Yeah, do you see that? It's continuous. It's very straight and has a very kind of smooth outline to it. So what are these structures that we're seeing bilaterally? I've already kind of told you the answer, right? Because I've said it's structures rather than fractures. So these are not fracture lines, but rather, drum roll please, these are pterygoid plates. Okay, so these are pterygoid plates that we see on panoramic radiograph. I don't think I've mentioned that too many times. I don't know if I've ever mentioned it on my previous videos, but these are pterygoid plates, and for some reason it could be positioning, it could be due to various of things. This pterygoid plate has more radiolucent appearance, and if you misread this feature, you could certainly consider fracture, but that's not the case for this patient. Okay, so two important things that you learn: mucus retention pseudocyst and recognizing the appearance and location of pterygoid plates, which extend immediately posterior to this posterior wall of the maxillary sinus. Okay everyone, I hope you learned something new. If you liked this video and learned something new, please hit the like button and please click to subscribe so that you can be alerted 3 times a week when I post new videos. Thank you very much, and I would like to help you to continue to become a better radiographic diagnostician. I'll see you again next time. Take care.